Hi, friends. It's Chance. This isn't a normal video that's being uploaded. A few months ago, I had said that I would make a video of ASMR for some sub goals, and I didn't think we would hit those goals, but we did. And I was told that me just talking would be good enough for that. So, fingers crossed that this is nice and relaxing. I'm trying not to whisper because I was told that's a no. I'm just trying to talk calmly. We're going to be learning about dementia. If you've been in any of my streams or if you've watched, some of my videos, you know that I like to teach what I learn in school. So while I'm teaching these things, keep in mind I am not a professional. So learn something from me maybe, but don't say, hey, Chance said this, so this has to be true. I could be, misunderstanding some things or, not representing information in the best way possible. So please keep that in mind. I don't know why I picked dementia. That was the page that I turned to on my notes. So congrats, I guess. I don't know if we'll go through the whole of dementia because it is quite a few pages, and I hadn't wanted to talk forever. Like dementia itself is, I think, 10 pages if we think one front, back, two. So we'll see. Let's get into it. So, first, let's define what dementia is. It's a acquired neurological syndrome that's associated with progressive deterioration of intellectual function. And there are certain criteria that someone would need to meet in order to be diagnosed with this. And that's, listed by the DSM. You would need to have deficits in learning and memory, in language, executive functions, complex attention, perceptual motor skills, social cognitive skills. And two other key things is it must interfere with your independence and it cannot be delirium. So you have all of those deficits, and then you have exclusionary criteria and inclusionary criteria. Those are all things that you need to consider to be diagnosed with dementia. And we'll talk about this later, but I think it's important to note now. Dementia is an umbrella term for different subtypes. So dementia is not only Alzheimer's, but we'll learn about dementia of the Alzheimer's type. Now, alongside dementia, it's also important to understand what a mild neurocognitive disorder or impairment is. This is often considered a preclinical condition that might suggest that a person is going to be at risk for dementia. We'll go over dementia risks as well. But it's been noted that 10 to 15% of people who have an MCI develop dementia each year. It's kind of like a transition stage. It's a natural, thing that can occur. Dementia is an unfortunate side effect that can occur. To be diagnosed with MCI, a mild neurocognitive impairment, you have to have self-reported memory loss, and you need somebody to also confirm that, so corroborate that. You also need to have measurable memory impairment that can be measured through standardized tests, which standardized tests are things that you use, almost in every diagnosis and everything like that. Those are just standards. They have specificity and sensitivity tests that have occurred to determine whether or not this test successfully diagnoses someone with the intended diagnoses. So, with that self-reported memory and that standardized test, you also can't have an impairment in your reasoning, general thinking, or ability to perform activities of daily living. So the activities of daily living, that has to do with your independence. That's something that can differentiate MCIs from dementia. is that independence that someone can still hold. But now we're going to go back to dementia. We want to know what the epidemiology is of dementia. So approximately 6.7 million Americans have been diagnosed with dementia, with 55 million people worldwide having it. And interestingly, it's been projected that by 2050, there will be 139 million worldwide who have dementia. When we think about cost, there's so many different factors coming into taking care of someone with dementia or diagnosing them with dementia. And that comes to 1.3 trillion worldwide cost is related to dementia, which is quite an abundant cost. So you have a abundant amount of people and a large cost. It's really prevalent. It's quite prevalent. And that's probably why we learn so much about it, or to a degree. It's something that's shared, that's something people are wanting to research and help with. Now, it's projected that in nursing homes specifically, almost half of the people in nursing homes likely have dementia. There are some that may not be diagnosed or have an official diagnosis, but that's just the projected amount. Now, what is the difference between just getting old and having dementia? The chart that I got this from specifically said Alzheimer's. And so I am not entirely sure how different Alzheimer's is from other subtypes when it comes to these comparisons that I'm going to make. So I will be saying Alzheimer's, but just keep in mind that Alzheimer's is a subtype of the umbrella term dementia. So when it comes to being forgetful, the average person is going to be seldom forgetful. Then you have someone with Alzheimer's, and they will forget entire experiences. And then you have an average older person who's 65 plus. They will forget parts of experiences, but not the entire experience. When it comes to remembering later, people with Alzheimer's, they rarely remember later. And people 65 plus, an older person, they often will remember things later. In acknowledging memory lapses, begrudgingly, those with Alzheimer's will acknowledge it. And readily acknowledging it is something that is commonly found with older persons. When it comes to skills, those will deteriorate, while for those who are just average aging folk, they usually remain intact. You'll have an increase in being unable to follow directions or make notes or care for yourself if you have dementia, whereas an average aging person should still be able to maintain that independence. Caveats being, there could be other morbidities that occur that make some of those things impossible, but those are baseline comparisons. So, as I previously mentioned, this is an umbrella term. Dementia is. There are subtypes, specifically 11 principal dementia syndromes, and that we'll go over. So you have degenerative, vascular, myelinoclastic, so like multiple MS, multiple sclerosis. You have traumatic conditions like subdural hematomas, neoplastic dementias, hydrocephalic dementias, inflammatory conditions. This could be like systemic lupus. You also have infection-related dementias, so things like syphilis or AIDS. There's toxic conditions like alcohol or certain metals or drugs. There's metabolic disorders, so kidney failure would be a good one. And then lastly, there's psychiatric disorders, so things like depression, mania, schizophrenia. within these principal dementia syndromes, there is another group, a small sub like category you can put some of them in. That's reversible versus irreversible. So about 10 to 15% of dementias are reversible. These are those that are caused by drugs, subdural hematomas, infections, inflammations, things like that. They're often shorter duration of symptoms. It's not going to be as severe, and you'll often find that prescription drugs are commonly found with alongside this. Then you have irreversible ones like dementia of the Alzheimer's type. Oh shoot, I skipped something. So we're gonna go back to an irreversible one to a degree, vascular dementia. And this is the result of bilateral repeated CVAs or strokes. And you're going to be at a higher risk if you've had hypertension. And it tends to be quite abrupt. And I believe this is a reversible one because you can kind of heal your brain to a degree. You can go to therapy, but when you have this one, because of the damage that's occurring in the brain, you'll also have other deficits that occur. You'll have other symptoms that can make it difficult. So you'll find you have motor deficits like dysarthria, or you can have dysarthria or dysphagia. You have incontinence. You can also have aphasia and apraxia, and that will have some fluctuation in performance, and that can make it very difficult. Other symptoms include gradual deterioration of intellectual abilities like nocturnal confusion, so not being able to sleep properly, depression, emotional ability, just not caring, inconsistent memory loss. You'll have poor judgment, thinking, and a hard time with abstraction. There will also be behavioral deterioration. So that's vascular dementia. Then we go to dementia of the Alzheimer's type. This is the most common irreversible dementia, with 60 to 80% of people having it. That's probably why when people hear dementia, one of their first thoughts is going to be Alzheimer's, because that's what is the most common. It affects a large population. You have 6% of people between the ages of 64 to 75 have this, with 18.7% between the ages of 75 to 84. And within that, who have been diagnosed with this, 23% are considered mild dementia of Alzheimer's type, 51% have moderate, and then 26% has severe. And we may not go over that in this video, but if I make a second ASMR video, I'll gladly go over it more, I guess. We don't know exactly why dementia occurs, unfortunately. We know that there isn't a single cause, at least not any that we can pinpoint, but there are certain risk factors that have been noted. So things like age or your family history. You're at like a 10 to 25% increased risk if you have family members who have been diagnosed with dementia of the Alzheimer's type. Interestingly, and I don't know what the connection is. I don't know if anyone knows the connection, but this is an interesting thing. For those who have been diagnosed with Down syndrome, you're at a 100% increase in the risk of having dementia, and you have it earlier. So dementia, you're typically going to associate it with those in their 60s and beyond. With those who have been diagnosed with Down syndrome, it will occur. You'll have early onset dementia, 40 years old, really young population, and at a greater risk. It's kind of scary. It's unfortunate. I'm not sure what the connection is, so I'd have to do more independent research in order to, determine what that is. but that was something that I found interesting. Other risk factors can include depression or hypertension, if you've had head trauma, and if you don't exercise. And there's several reasons for that, due to some causes. I'm not going to go into those because I know I can't say all the words correctly that are related to it. But that's okay. So, I talked about the percentage. 23% of those with Alzheimer's have mild or being diagnosed with mild, and that typically lasts for somebody between, you're in this mild stage between 1 to 3 years. Whereas with moderate, that lasts between 5 to 7 years, and then severe can last anywhere between 2 to 5 years. And so, worst case scenario, you have 15 years of your life just existing with dementia of the Alzheimer's type. On the lower end, that goes to 8 years. So that's like a wide range of time, a large amount of time for someone to be experiencing the unfortunate deficits that come with dementia. And it can be very challenging. Really quickly, if you do know someone who has dementia, it can be very difficult. It's okay to not be okay. There are support groups, there are caregiving groups, and if you can't be the main caregiver, that's fine. No one's going to be mad. And if they are, they don't understand. Okay? And if you are in this position where you're taking care of someone with dementia of the Alzheimer's type and you get frustrated and you don't want to do it anymore, it's understandable. A lot of people, it can be quite difficult for them to have to see the person that they love deteriorate. And there's nothing wrong with being upset with this diagnosis. But with this diagnosis, with the early stages, you'll find that there are subtle memory problems, impaired visuospatial skills, so like being able to perceive things, analyze, transform, synthesize visual things. You'll have reasoning problems and poor judgment. There will be disorientation, and you'll find mood changes, and that can include like increased depression or some indifference, which the indifference can be very difficult. It's like, okay, you don't care. That's awesome. Thank you for telling me that. Like, okay, cool. You don't care. Thanks. Get that. I know for me, that would be very difficult, is having that indifference of like, do you not understand why certain things are important? It's not that they don't understand. They do have that. They just have this indifference that occurs. Now, alongside those problems, specifically language problems, things that you'll find is they'll have mild naming problems, verbal paraphasia and circumlocution. They'll have subtle difficulty comprehending abstract meaning, implied meaning, and humor. Impaired picture description, difficulty generating a list of words that begin with a specific letter, difficulty in topic maintenance, repetitive speech, and impaired comprehension. And with this, you'll typically find that articulation and voice, syntax, automatic speech, those tend to be unaffected. In later stages of dementia of the Alzheimer's type, you'll find severe memory problems, generalized intellectual deterioration, restlessness, agitation, hyperactivity, profound disorientation to place, person, and time, and this is when they'll start to really wander. They'll have difficulty dressing. They'll lack an affect, tact, judgment, so they'll have that social indifference. And in the latest stage in dementia in general, they'll have motor problems, increased weight loss, complete incontinence. With language problems being that they'll have literal paraphrasia, empty speech, jargon, hyperfluency, or like a rapid rate of speech. They'll talk a lot. They'll have impaired auditory and reading comprehension. They'll have an impaired time reading aloud. And they'll have something called echolalia, which is when they repeat others, or palilalia, which is repeating themselves. In the latest and final stage, they're going to have difficulty initiating conversation, and they won't really have meaningful speech. So when I say difficulty initiating conversation, they will have difficulty having conversations, asking for things, telling you if they're in pain and things like that. When it comes to no meaningful speech, that is a hallmark for the latest stage. And it's, quite difficult for families to experience. So those are the stages of dementia. I'm at around 20 minutes, a little over, and I think that's what I wanted to go for. I hope you guys like this. I talk a lot. And I know that in my Discord, if you're not a part of it, join it. But I know in my Discord, I've had nights where I just talk, especially when I was studying for finals, and people would fall asleep in the Discord. So I hope that this was enjoyable. And for those who like to fall asleep listening to somebody talk, I hope that this is a good video for you. Hopefully, I don't wake you or anything with my voice or like turning the page. But thank you. Please, give me a follow, leave a like. I don't know, is this what people do for YouTube? I'm a Twitch streamer. I don't make YouTube videos, so I'm a little out of my depth. But I appreciate every single one of you. And thank you. Have a good rest of your day.